Happy Thursday and welcome back to another episode of 10 a.m. Tea with Natalie. It is 10 a.m. Pacific, 1 p.m. Eastern, and I'm back with you guys on Facebook Live. I just finished my daily cardio routine. I spent about 35 minutes or so on the elliptical today. And since my patient day actually starts a little bit later, I don't have to be into the office until noon. I decided to sleep in a little bit and then push my workout routine off. So I'm just checking in with you guys a little bit sweaty. But it's kind of fitting since we're talking about exercise, right? And I should be leading by example. Who the hell am I to tell a bunch of people that they should be exercising and then just be sitting on the couch myself, right? Can't do it. So we talked about walking yesterday, how to begin a walking routine, which is basically start by counting how many steps you're doing and incrementally build from there. I think that once a patient reaches about 4,000 steps a day, it's a good time to start thinking about adding cardio to your routine. And as we talked about last week, you're looking at that more moderate intensity exercise situation. So you're looking at 50 to 70% of your maximum heart rate, which is 220 minus your age, is your maximum heart rate there. So then you would calculate 50 to 70% of that. And that's what you should be doing on average 150 minutes per week. Okay. So, I'm not expecting my patients to go from no minutes of cardio to 30 minutes of cardio. It's a lot. I definitely think starting in 5 to 10 minute intervals is a good place to go. And you can kind of work it into your day. You could do 10 minutes in the morning and 10 minutes at night, or just start with the 10 minutes and kind of see how that goes. And then the next week, make it 15 minutes and then 20 minutes and incrementally build your way in. Good morning, Scott. Thanks for checking in today. And so, you really do want to transition to the moderate intensity cardio to really get the health benefits and to increase your weight loss there, because that's really what keeps people sticking with the plan when they're getting the body that they're wanting. And start with 2 times a week and work your way towards 5 days a week. And don't have those 2 days be Monday, Tuesday. Spread it out a little bit, maybe a Monday, Thursday or something like that, or a Tuesday, Saturday. Make one of the days a weekend day. Maybe that might make it a little bit easier to stick to it, depending on what your schedule looks like. So you also need to think about starting slow. It's really important that you can still get off the toilet tomorrow, be able to walk to your car the next day, be able to get out of the car. These are things that you need to think about when you are starting your exercise routine. And it's, just because you feel strong in the moment doesn't mean that, your body can really handle it. There's a condition called delayed onset muscle soreness, which is something that I've really been experiencing a lot of as I've been kind of increasing my fitness routine. And so delayed onset muscle soreness basically means you have that, pain related from overtraining and increasing your resistance in different ways because the muscles are tearing, and it's showing up 2 days later, 3 days later. So you have to be really conscientious of this. You don't want to be setting yourself up for, a huge roadblock. If all of a sudden you're having like 9 out of 10 muscle soreness and pain, it's going to make it really hard for you to continue working out. So please start slow and steady. I realize that, there may be dates this summer, weddings and reunions and different things that may make you want to have, reaching a specific goal at a specific time. But it's really a better scenario if it takes you an extra couple weeks to get there, but you didn't have any injuries or collateral damage along the way. So that's something to really think about. Listen to your body. Be careful. If you're injured, frickin' wait for it to heal and go and check in and see somebody. See your acupuncturist, see your chiropractor, see your primary care. Make sure that you're doing all the things that you should be doing to keep yourself safe. And a lot of people don't know how hard you should push yourself. So if you're kind of in that zone of not knowing where you're supposed to be, please, check in with a trainer. Take a class. Educate yourself so that you know where you should be in that sweet spot area, especially if you're having issues with, heart rate and figuring all this stuff out. Definitely seek, more personalized advice for yourself. Don't struggle. So you can definitely break it up into 10-minute segments throughout the day. 3 10-minute segments equals 30 minutes. For your heart benefit and stuff, though, I do think that kind of having it be consistent, like doing the whole 30 minutes at once, is kind of a better scenario. But, some is better than none. And if it's broken up, that's better than none at all. So please, do what you can and don't beat yourself up for having it not be perfect. Make sure that you're warming up and cooling down. Spending 5 minutes in a lighter area before you ramp into your cardio routine is really preferred to kind of get those muscles circulating and get the blood flowing there. And making sure that you're taking time to cool down so you can circulate those tissues really well before you stop exercising to prevent any kind of soreness or potential issues there. Make sure that you're doing your stretching. Make sure that you're drinking lots of water. For me, if I don't do my stretching, when I get out of the car, when I get to work, I feel like I'm made out of wood and I can just like hobble around, and that looks really bad. How am I supposed to be taking care of people and helping them, you know, with their bodies if I'm not taking care of my own and I'm walking around like a zombie? You're probably not going to take me too seriously. So these are all things that apply to all of us. We need to always be reminded to kind of be following all those steps and checking in there. So I hope you found that to be helpful. If you think that someone else could benefit from this information, definitely share this with them, tag them. If you have any questions, comments, concerns, definitely put them below. And I really hope that you're kind of taking some of this advice to heart and that you're able to apply it to your day-to-day activities and really, you know, be strong and healthy by summer so that you can do all those things that you want to do when the weather's nice outside, right? So I hope you have an awesome day. Take care of yourself, have a glass of water, and check back in tomorrow, 10 a.m. tea with Natalie. Let's take a look at the notes here. What are we going to be talking about? Ooh, resistance training. This is one of my favorite things, ladies. Metabolism. So make sure you check back in tomorrow, 10 a.m. Pacific, 1 p.m. Eastern. I'm here every Tuesday through Friday, 10 a.m. tea with Natalie. Have an awesome day. Take care, and I will see you soon.